Viewers, we will be talking about assessment blueprinting, and we are planning this short audio tape for the request of some of our colleagues. So before we proceed, please subscribe, join a hand so that maximum educational benefit can be obtained from this audio tape globally. These are the objectives to develop an assessment blueprint for your own educational course or whatever you have targeted. Remember, blueprinting is a design or initial construct that contribute to the development of a course so far curriculum is concerned. In case of assessment or test blueprint, it is important to understand that it relates to the knowledge and skills that you want to assess and will enable you to build a purposeful, driven, successful assessment procedures, methods that you adopt, and keeping in view the Professor Harden's 12 principles of assessment, like one of them is assessment for learning, and assessment should be fair, and assessment is for learning, and not a single method will do all this for you. So keep in mind that assessment is a cycle. You incorporate an instrument, you get what you can see the results, and then you revise your plan subsequently, and then you teach according to that method, and you measure again, reassess, and then reflection is there, feedback, and then you improve it. So it's a continuous process. Now, having said that, you see, your course or curriculum may be based on learning objectives, it may be based on learning outcomes, you see, or it may be a content-based curriculum or an outcome-based curriculum, and you perform certain activities, and then at the end you assess, and once your students is here, that is the entry point, and then here is the exit point. So this will give certain competencies to your graduate. Thus, at the exit of the program, your student gets some standards, gets qualified and meets some standards upon which you have scaled that particular graduate. So what is important? Assessment, alignment, educational activity alignment is important in this regard. And for example, this is a curriculum, you see, and this inside the circle, this is the whole curriculum, and then teaching is at this level, mean it is totally skewed at the left, meaning that your curriculum is something else and teaching is something else, and then you assessed, you see something else, and this area is totally out of what you have taught and what is planned in the curriculum. So therefore and the students learn something else, you see. So therefore, it is very pertinent to mention that alignment, educational activity alignment is very important, and probably that's the reason that we go ahead for the assessment blueprinting. Otherwise, so many classes or segregation of activities and that phenomenology happens that would be difficult to regulate, and that leads to problems. So now, educational alignment is important. You see on the left side, this is a curriculum and educational activity without blueprint, and this is a blueprinted curriculum that all these things are aligned at the what you can say centripetal forces, and you get the desired targeted standards. So the aims are what? For example, after delivering an assessment instrument, so you see what the students say. Oh, the question were too vague, and you can see this stool-empty question. All question or system are only from one system. No question from this, blah, blah, blah. And long question were particularly the bouncer. So different students have their different approaches. And if you do assessment blueprinting, all these questions will be minimized, or mean the assessment process will be optimized as per the student's requirements. The program requirement rather. So you can see this is one of, objective is first, and then one or two or three objective gives you one outcome, you see, and this outcome, then many outcomes, you see, many outcomes. For example, outcome number 1, outcome number 2, and this is outcome number 3. You see, these 3 outcomes then gives you a competency, you see, a single competency. So nowadays, usually a competency-based curriculum is there or content-based curriculum is there, but the people are usually targeted on outcome-based curriculum or competency-based curriculum, like CanMed in case of medicine, you see, and they have targeted certain things. But keep in mind, your objective is assessed in perspective of either effective domain, mean through the OSCE or role model, or psychomotor domain through OSCE, and then cognitive domain, mean knowledge or multiple choice question or written test instrument you administer. So in blueprinting, you assess the each objective or each outcome, you see, while keeping in view, this is a very technical point, keeping in view alignment with the competencies. So a program might have different competencies. For example, this is a program, this is a general sketch. So there may be first outcome, second outcome, third, fourth, five, sixth, and seventh outcomes. And that outcome gives you one competency. So there can be many competencies. And but remember, all these things are within the curriculum framework. And you see, I have just written this, draw this curriculum framework. So, some myths are there. You see, people say it is not out of course. My dear, it is not the matter of out of course or out of content. It is the matter of how prioritize your curriculum. So therefore, the curriculum framework is very important. But above ahead, I mean curriculum framework, the assessment blueprint will prioritize the things for what? To assess, to gain particular competencies that has been set for a particular program. Thus, different programs have different competencies like medicine, dentistry, pharmacy, nursing. So for a health professional, you see, usually what we expect that a physician shall be a medical expert. He shall be communicator, health educator, collaborator, professionalism element should be there. He should be a leader, and above all, he should be a scholar as well. These are all CanMed's, Canadian Medical Association, key competencies or competencies being what is expected from a medical doctor, you see. So important is to understand that all these competency standards gives you a professional doctor, a doctor who is expert or health professional. Now, what is to understand? The point of concern here is that every standard, remember these are different standards, scholar, communicator. So if I merge these rings, circular rings, competencies, you see, it makes a matrix. But remember, within this each competency, like if I take the scholar, this is one of the competency. It has its own matrix of outcomes, and at the beginning and the outside, you see, if I carry you, this outcome, and these outcomes is then linked with different program and course objectives. You see, our problem-based learning curriculum is there. If that is a problem-based learning curriculum or blended curriculum. So you see what will be there. There will be some objectives of the PBLs as well. So here in this particular scenario, you have to prioritize the things that amongst which standard, you see, this one, this one, this one, this one, how much proportionate you are taking each particular aspect into its importance. What in fact I want to give you a message that how much proportionate you have targeted that the student must know. For example, the student must know mean that shall be given the weightage of 60, nice to know, should know would be given a weightage of 30, and nice to know should be given a weightage of 10, and the whole this weightage is 100%. Therefore, every competencies, for example, this is competency number 1, 2, 3, 4, 5, 6, and this is 7 competency, you see. Every competency must have its own proportionate important aspects, and that shall be prioritized while setting what you can say while setting assessment blueprint. Therefore, the vision of the program is very important, and the standards of the programs are very important. So for a medicine, this is what this you can see in this program, this slide. CanMed key what you can say the competencies that have been set for a graduate who is expert in medicine. So remember, assessment drives learning, and assessment is for learning, and it's not a single method of assessment will do all for you. Therefore, while preparing matrix and assessment blueprint, you shall align all these things in perspective of the standard of the program, whether the program is related to medicine, dentistry, pharmacy, or nursing. And therefore, every program will have its own relevant standards, and that standard shall be given a respective weightage, and that can then you can then once your candidate or graduate gets degree, he will have flavor of all these particular what you can say standards. So thus, when you are going to making an assessment either for a mid-block program or end-block program or the whole semester, you see, you will plan the number of multiple choice question, you see, and here for the must know means 60% of the weightage, how much proportionate number of multiple choice questions shall come, that is 30, and if the MCQ number is 50, then 30 shall come from the must know, and if the MCQ number is 15, is 50, so 15 shall come from the should know mean 30%, and 10% mean 5 MCQ shall come of the total 50 on a point, on a standard where a student is being asked that nice to know. The alternate method is that you multiply the impact of a content with the frequency, mean how frequently you come across with a particular point, and that will give you a particular value, and this is that value, that if this value is high, mean impact multiplied by frequency, that value is high, so the more important that is, therefore a weightage should be given to it, and more questions will come from this. So thus you will give much more impact multiplied by frequency, that the greater the value you see, and the greater that value shall also be given preference in these relevant outcomes, you see, or core competencies. Consequently, this will lead to a quality production of quality graduates. So now, what shall be for an MCQ? For MCQ, if you are going to plan, so you just plot MCQ, you see the targeted outcomes or the contents here in this column, and categorize them: must know, should know, and then nice to know. And if the number of multiple choice question is 9 from pharmacology, you see, so what you will do, 5 shall come from must know, and 30% mean of this 9 mean 3 shall come from the should know, and nice to know mean 1 MCQ will be from this. But remember, it's up to you how meticulously you plan it, especially in an instrument, whether you are going to press it at the level of recall or understanding or analysis. That is that shall be left to the tutor. Well, he shall be asked to more focus on the targeted standards of the program. So thus there is another way, that with a discriminatory index of 0.3, so totally on average you require 50 to 60 number of multiple choice question to assess, though it is related to the number of students and some other factors. So you can and a discriminatory index you require 100 MCQ as well. So this is an alternate method, especially when you are planning for a curriculum which has not been delivered, and just for a planned curriculum you can decide the number of MCQ like that. This is an alternate method. So if we recall the previous slide, so each objective is now assessed in perspective of Bloom's taxonomy, or similarly outcome is assessed in perspective of Bloom's taxonomy, and all outcomes is being already prioritized as must know, should know, and nice to know, and thus you assess this contributes to a particular competency. So in summary, if you are going to plan for an MCQ blueprint, what you will do, first list the topics to be tested, give the impact and frequency as I said previously, and give a properly weightage how that must know, should know, and nice to know. This is 60%, 30% you see, and 10%, that is. The second point is decide on the number of questions per topic. This can be taken from the discriminatory index as I referred to on 0.3 discriminatory index. Usually you require 50 to 60 number of MCQs, and on 0.2 discriminatory index you require how much? 100 MCQ. So you will take this, and then the third step is decide the level of Bloom taxonomy, whether you are going to make it on recall or understanding or application. And the fourth one is that decide on the number of questions per level. So it shall be aligned with respective standards, and then decide the difficulty level of each MCQ, so that whether that should be easy, medium, or what you can say difficult. As a rule of thumb, 20% MCQs, 20% MCQs shall not be, there shall be only 20%, up to 20% MCQ shall be there with the difficult level. So and the discrimination index should be at least targeted at 0.3. So this is how you will plan your assessment blueprint, keeping in view all these competencies of the program. Remember, if you have not planned the blueprint in perspective of the program standards or vision, then there will be no production of quality graduates. So what we advise for you, in summary, align your curriculum, you see, on all activities like assessment, teaching, and all other activities that shall be aligned, and a blueprinted curriculum can produce a quality graduate. And here on your right side, this is without blueprint curriculum, and it will be difficult for you to attain the target standards and produce quality graduates. These are the references, and thank you very much.